welcome to the Science in the Newsroom Global eSummit. This is the first time we're holding a summit of this nature within the WAN-IFRA suite of summits, and we're incredibly grateful to be able to do so at a time when science matters like never before. So welcome to everybody. As people trickle in, I'll just give you a little bit of background about what we're doing and why we're doing it. A conversation started in 2013 about the problems related to science journalism. And it started from a group of pharmaceutical companies who were incredibly frustrated with the level of understanding of science issues in the newsroom. And they had a point, because systematically over the years, the capacity and skills level of science journalists had been eroded. Normally in newsrooms, if cuts had to be made, it was easiest to take out the specialists and to bring them back on some sort of contract where it was a sort of as needed basis. But in fact, what we were seeing then was the first stages of the misinformation movement, if you like, undermining science, not really believing in science. And I think a lot of the companies felt that it was journalism's role to differentiate between what was right and what was wrong. And in fact, we know now that it's a problem that's so huge that even the best trained science journalists can't on their own address the problem. So we began talking about and had a couple of Science in the Newsroom projects over the years, including training, but it's come into its own this year. And thanks to the sponsorship from Temasek Foundation, we've been able to put together fairly detailed training for newsrooms, and we've been focusing on a couple of regions, and we hope next year to expand it, because we can see that the science related issues are going to be with us for a long time to come. And that's really what this program is about today. It's about looking into the future, and we've seen from this year that you can't really tell what's coming, but you can be better prepared and move from a reactive basis of news stories to actually more of a proactive planning and looking ahead. So before we get going, just to thank the International Science Council and Quest, two projects that have been instrumental in helping us get this program together. You'll meet the people later on in the program. But again, thank you to Temasek and to those two parties. Before we get going, there's some little housekeeping. There's a Q&A box at the bottom. If you have speakers, put them in there, and we will make sure the moderators get to see them. If you are tweeting, we'd be grateful if you use the hashtags SCN20 and Newsroom Science. Then once this conference is over, we'll be putting out a special report for newsrooms journalism in the age of pandemics. It's a culmination of the wisdom, best practice, and practical advice that we've been able to draw from our recent trainings and from this seminar. It'll be free, so if you're on our list, we'll make sure you get a copy, but watch out for it probably middle of December. I'll come back to that over the next day or two. Then if you are following on Twitter, there is a Science in the Newsroom Twitter account. That's the handle there. So before we get going, I just want to quickly tell you why we've got this session as it stands today, and then I'll hand over to Salma. Today's conversation is really to frame the next 2 days. We talked about looking at what the World Health Organization is planning for future health crises, because everyone is telling us there are more to come. So what's on their agenda? What are they dealing with? And this is away from the political issues around the World Health Organization that we've seen this year. Dr. Sylvie Briand and her team are on the front line of planning, and it promises to be a very, very interesting talk. And then immediately after, we'll be followed by Prof Neves, who he's a vet by training, but he's been part of the reports on biodiversity and pandemics that has just come out, that has had a really good look at the relationship between biodiversity and health, and how disease looks like it'll cross species more often. And he's got a lot to say. His slides are quite fascinating, so that promises to be really good. And then just to give us a bit of a quick masterclass in stats, Prof Denise Lieveseley, who's got a CV as long as my arm, been involved in using statistics at very high level to inform policy. She draws a strong relationship between journalists and statisticians in using independent sort of fact-based information to hold power to account. So 3 really good speakers to set the stage. So I'd really like to introduce our moderator, Salma Khalik, who's the senior health correspondent at the Straits Times in Singapore. Over to you, Salma.
Thank you, Sherilyn. As a journalist who has been covering the COVID-19 pandemic this year, I must say I certainly would appreciate all the help I can get to better cover the current pandemic. With me today are 3 speakers, as Sherilyn has said, who will be sharing their expertise to help journalists should they be faced with future health or environmental disasters to do just that. Now, each speaker will be giving a short presentation, after which the session will be open to questions. To start, we have Dr. Sylvie Briand, the World Health Organization's Director for Global Infectious Hazard Preparedness. Dr. Briand brings with her a wealth of experience, having dealt with infectious diseases ranging from influenza to Ebola. Today, she will address the proliferation of news on COVID-19, not all of it accurate, and how it has impacted the global effort. Dr. Briand. Dr. Briand, are you there?
Yes, I am here. Thank you very much. And good morning, good evening, or good afternoon, everyone. I will start sharing my screen. I hope it's working. So first of all, I would like to thank you very much for inviting me. It's a great pleasure for me to be here with you today and to share some of WHO's thoughts and programs about this topic. And I will start immediately by looking at the past and at the past epidemics, actually, that we have seen since the beginning of this century. As you see, we had SARS at the beginning that affected enormously Asia, and H5N1 at the same time. And then we had plenty of epidemics and pandemics that have been really threatening the entire world. The pandemic influenza in 2009, cholera in Haiti, MERS, H7N9, Ebola in West Africa, Zika, yellow fever in Central Africa and Brazil, Ebola in DRC in the past years, cholera, plague in Madagascar, and more recently, COVID-19. So as you see, it's becoming more frequent. Epidemics that were localized in the past tend to now become more widely spread and faster as well. And at the bottom of this slide, you see also what are the mechanisms that the international community has put in place to try to deal with those threats. And we had in 2005 the revision of the International Health Regulation. We had the Pandemic Influenza Preparedness Framework in 2011, and many other instruments like the Research and Development Blueprint for Emerging Disease in 2016. And all those instruments are now being reviewed in light of COVID-19, because we have seen that we have constantly to adapt to the emergence of those new pathogens and make sure that our mechanisms at national but also global level are fit for purpose. So why do we have more and more outbreaks those days? The main reason is really mobility, because we move a lot, and therefore viruses who are with us are moving as well. And here you see the number of kilometers that human beings are traveling every year, and it corresponds to 20,000 round trips between the Earth and the Sun. And this mobility and these figures was from a few years ago. So before COVID-19, it was even worse. And so this explains why we have more and more epidemics that before were localized and now are becoming more and more widespread. So what are the contributing factors for those epidemics to emerge and then to spread? Many factors are due to our way of living. And this is, for instance, international mass gathering, the Olympic Games, being one of them, the increase in transport and international trade, the change in ecology, the condition of living, and mainly the urbanization, because here we have more population density and so more opportunity for a disease to spread. We have also changes in food production, and the use of lands and agricultural practices are changing as well. So all of these things contribute to amplify epidemics that were before very localized and now become widespread. But there are other factors that are also important to take into consideration, because those factors are the ones that increase the virulence of outbreaks. Although we have made a lot of progress in medicine and we are now able to treat most of the disease that exist on Earth, there are some factors that really increase the virulence of a given virus. One of the main factors is really the poor healthcare systems. And you have seen in many outbreaks that people are dying from disease that can be cured, but the health system is not able to cope with this, and then people die. There is also very limited access to care in many regions of the world. And you see this again with COVID-19, for instance. Now people are really afraid that when we have a vaccine, not everyone will be able to access it. Because of the price or because of the availability of these medical products. There are conflicts and war also increase the virulence of outbreaks. Drug resistance is also increasing a threat for human beings. And humanitarian crisis and natural disaster are also contributing to increase the virulence of outbreaks. And you probably remember this large cholera outbreak in Yemen a few years ago. So what is next? This is the main question. Everybody is trying now to anticipate what kind of outbreak or pandemics we will have to face in the near future. So predicting is very difficult. But what we know is that, for instance, influenza viruses are very prone to reassort and change. And therefore, there is a high likelihood that we will have another flu pandemic in the future. We have had already 3 flu pandemics in the 20th century and 1 in the 21st century. Fortunately, the H1N1 pandemic in 2009 was not as severe as the previous one, because now for flu we have vaccines, we have antivirals, and we have extremely good supportive care that allow us to mitigate the impact of such events. But still, in 2009, we had between 200 and 400,000 deaths due to flu, and mostly in young adults. And this could be preventable. So that's why we are working very hard to prevent those phenomena to happen, or if we cannot prevent them completely, at least mitigate their impact. The other potential risk is due to vector-borne diseases. You have seen that we had the emergence of Zika in 2016 that spread across the world and affected many, many countries in the world. We know that there are many more arboviruses that are out there and have the potential to create similar events. And so we are monitoring them very carefully to make sure that at least when it starts spreading, we can stop the spread very early on. So the other thing we are looking at also is any kind of phenomenon, like we call it disease X. which is any kind of pathogen that can emerge and then start transmitting and generating large epidemics. What we know is that it's very likely to come from animal reservoir, because since so far most of the emerging disease, at least 70 to 75% of them, are coming from animal reservoir. So we are working very closely with human health and animal health agencies to make sure that we can monitor these risks at the human-animal interface. So what are the features of contemporary epidemics? First, as I said already, the rapid international spread, but also their enormous impact with travel and trade. And you see this with COVID-19 now, but it was the same with previous epidemics in the past decades. We see that most of the epidemics are the convergence of multiple factors of emergence and amplification. And so we are now monitoring certain hotspots of emergence in the world so that we can detect as early as possible the emergence and then prevent the amplification of such events. There is also an increasing role of the community and civil society because as it becomes a globalized epidemic and a globalized risk, everyone has to contribute to reduce this risk. And that's why it's so important to engage communities and civil society in the fight against those epidemic disease. And I know that my colleague will have a talk later on in this meeting, and we'll talk more about how we can engage communities. There is also, now we have seen with COVID-19, it's even more apparent that there is a strong impact beyond health because we are in a globalized world, and therefore those epidemics are worsening inequities. And we see even with COVID-19 that it's the most vulnerable that are paying the higher price to this outbreak. And then finally, the infodemic, and I will talk about it later on. So there is one specificity of epidemic is a fear. Epidemics brings a lot of fear and also a lot of uncertainty, and even more uncertainty when it's a new disease, like for instance, COVID-19. But how can we manage the expectation and the fear in the era of social media? Because you have noticed that our world has changed enormously, and you see those pictures in 1916, people were reading newspaper. Now everybody is connected and can have 24/7 access to news and information. And so it's very hard to manage this tsunami of information that we call infodemic. Also, what is really important to notice is that everyone now is an author, an editor, and a disseminator of information. So how can we also manage this? How can we train people to be a good author, good editors, and good disseminator of information in this century? So as I said previously, infodemic is a real issue nowadays. And as my Director General, Dr. Tedros, is saying, we are not just fighting an epidemic, we are fighting an infodemic. And to fight this infodemic, we need new tools and new approaches. So as I said before, infodemic is a tsunami of information, good or bad, but it includes also false and misleading information in the digital, but also in the physical space. And an infodemic is really the tsunami of information that happened alongside an epidemic. So it's not a new phenomenon. We used to have infodemic before as well, but the size, the intensity of the infodemic is very new. And COVID-19 is really the first ever event where it has been really overwhelming. And what is the problem with infodemic? First, it leads to confusion because people really don't know who to believe, what kind of information is right, what kind of information is trustworthy. And so people don't know how to behave. And so they may take risk by taking, for instance, medicine that are promoted as a cure for COVID-19, but in reality, it's a poison. And we have seen this in Iran, for instance, where 400 people die due to methanol, and which was not a cure for COVID-19, but on the contrary, put their health at risk. And they can also adopt harmful behavior because they don't really know what is the risk for their health. But ultimately, it has led to mistrust in governments, in the public health response, and even in science. And this is why infodemic is really something we need to manage, because we cannot eliminate it, but we can manage it better. And this happened also in science, because you have seen probably since the beginning of this epidemic and pandemic that the number of publication, scientific publication is overwhelming. This is somehow something we wanted to create because in past epidemic, we have seen that the science was quite slow, and usually publication on a topic related to the ongoing epidemic was very delayed, sometimes 2 years after the end of the epidemic. So we really wanted this publication to be faster so that we can access knowledge nearly in real time. The problem is that it has led to an overwhelming trend of publications, scientific publication. We don't have time to peer review them. And so you have seen everything on open access. And it's very hard now, even for scientists, to differentiate good information from bad information because sometimes you don't have access to the full data set or the full methodology, and just a snapshot of results that are very difficult to interpret. And so you see on this slide, I'm just comparing the previous way by which knowledge was generated in the Encyclopedia Britannica, where you had 40,000 articles already. But now in Wikipedia, for instance, you have 6 million articles for a given year. So it's enormous, and people don't have necessarily time to compare and to verify this information. So we are living in a new world. On one hand, we are still in the physical world, and we are still talking to our neighbors and friends face to face when you don't have a lockdown. And we are also living in a digital world. And everybody lives in these two worlds. Those two worlds are not disconnected. They are intrinsically communicating between each other. And because we are all living in these two worlds, we need also to learn how to live harmoniously in these two worlds. Of course, the proportion you spend on digital world, of your time you spend on digital world and physical world may vary between individuals and communities. But even in the most remote places in the world, we see people having access to this tsunami of information. So because this infodemic is really challenging with the rapid spread of mis and disinformation through social media, we need to really understand this phenomenon and understand as well that we are all frontliners in managing infodemic. Everybody at its level has a role to play, but we need to learn how to do it better, and we need also to set a code of conduct to facilitate an open and constructive dialogue. Instead of stopping communicating, we need to just learn how to better communicate. And my colleague Melinda Frost, will talk more about it in her presentation tomorrow. So one important thing is, of course, to do fact-checking. And this is true in science. We do it through peer review. And in journalism, it's really fact-checking. And now we are more and more fact-checking organization, more than 200 actually currently. And we are trying now to bring them together so that we can join forces and reduce the burden of checking facts given the tsunami of information we are facing. And finally, At WHO, we have created a new scientific discipline, the infodemiology. We brought together a number of scientific disciplines, from data scientists, epidemiologists, ethicists, social scientists, risk communication specialists, community engagement specialists, digital health and technology application specialists, and so on. And why did we do this? We did this because we think that we need now a science to better understand the infodemic, but also if we want to provide recommendation to better manage infodemic, we need those recommendations to be evidence-based. And this is why we need all the scientists necessarily to help us to first better understand the infodemic, but also to help us to find better intervention to deal with the infodemic. So as we do for medicines, where we need vaccine, drugs, and diagnostics, we need the same for infodemic. We need also vaccine, drugs, and diagnostics to protect the population against infodemic. Thank you very much.
Thank you, Dr. Briand. That was very interesting, although I must say you've painted a rather grim picture. If the scientists themselves have difficulty telling good information from bad information, what about the rest of the world and journalists? What do we pick up on and what do we not pick up on? Right. So I'm glad that WHO is setting up this group to look into things like that. But could I ask you, for this particular pandemic, were there any particularly wrong information that created a lot of problems to WHO, to governments fighting the current COVID pandemic?
Yeah, thanks a lot for your question. Yes, I'm sorry if I sound pessimistic. I think I'm very optimistic because the new technology allows us also to reach out to more people and to provide also more good information as well. But it's true that misinformation and disinformation is a risk that we need to monitor and manage better. And in terms of those risks, I think there have been a number of information that I think have been detrimental to the response. But it's, in fact, as I said, it's not new. I mean, we see in every epidemic rumors about first the disease and the origin of the disease. Second, we see also rumors about the disease. Is it real or is it, does it exist, or is it a fake news to talk about this epidemic? And finally, we see rumors or difficult conversation about the interventions. And people doubt about is it the right intervention, or should we really be compliant with this kind of intervention? So again, we see this in every epidemic. For instance, during Ebola, people didn't want to go to the healthcare facilities and Ebola treatment center because they were afraid of that somebody will kill them and take their organs to send them to the northern hemisphere. So we see those rumors over and over again on the same topics over and over again. So I think this is where journalists can really help, because for me, journalists are really being the mediator between the science and the population. So they have a very important role to play to distill the science, explain how the scientific process works, and how it's normal during a new pandemic or epidemics to have uncertainties. It's normal to fear and to really be fearful for your health, but also for the health of the others. And so journalists have really a role to play, not only to deal with this new knowledge and how to translate this new knowledge in actionable information, but also to mitigate the fear and to reassure when it's needed to be reassured, but also be very transparent about the risk so that people can use this fear not only to escape and really try to avoid the risk, but just to consciously look at the information and try to adopt the right behavior to protect their health.
Thank you. Now, we'll certainly try to do our best to tell people the truth, to tell them when things are not sure, and we'll keep doing that. You know, earlier you mentioned that one of the problems is that some countries have poor healthcare systems, and that makes it difficult for them to cope with the current pandemic. Now, we've known that for a very long time, so that's nothing new. Do you think things will improve before the world is faced with another pandemic of this size?
Yeah, I think it's now being, because before, you know, many of the pandemic, at least in the past century, in the 20th century, we thought that a pandemic or an epidemic, if you have no treatment, you do nothing. You just isolate people. And even for Ebola, before we were calling this Ebola Isolation Center. So really the care during pandemic was not really an issue. We were more focusing on non-pharmaceutical intervention. But in the recent past, first, we have understood that it's very important to treat people. Even if you have no specific treatment, you can still reduce mortality by just applying good care standards. And then it's also very important to accelerate research on therapeutics, vaccines, and diagnostics. And this is what has been happening for this pandemic, because you see 10 months after the start, we already have a potential vaccine, and we have some treatments available as well. So this recognition that caring for people, even if it's a new disease and even if you don't have specific treatment, is really important. And that's why I think now many countries will start to strengthen their health system as part of their pandemic preparedness.
Right, thank you very much, Dr. Briand. We'll go to the next speaker, who is Professor Carlos Gonzalo das Neves. He's a veterinarian specializing in virology in wildlife species. He is also president of the Wildlife Disease Association. Now, many people believe that future public health crises are not just inevitable, but could even be worse than the COVID-19 pandemic we are now facing. Professor das Neves will highlight drivers of risk that journalists need to watch out for, which may hopefully help us to escape the era of pandemics. Professor das Neves.
Thank you very much, and good morning. I'm just about to share my screen. There we are. Thank you for the invitation, and special thanks to Dr. Briand as well for this very interesting first lecture. I know her team is very busy these days with COVID, so it's very nice that she had a little time to share also with us. As I introduced just some acknowledgements, I would like to test here a short poll that you should be getting right now, just to feel a little on who is listening. So if this works, you should have received 2 polls right now, and you can look into it. While I just very quickly say that, well, I'll try to go through some topics, but of course this is the work of a lot of people. And I should of course here acknowledge both the International Panel for Biodiversity and Species Conservations, EcoHealth Alliance, and other people that spend a lot of time working on this topic. And as just been introduced, IPBES has just come out with a report. I was fortunate to be one of the 22 people that worked hard on this report. And the report, if I only had 2 or 3 minutes to give you a sort of a pitch talk, it's all about escaping the era of pandemics. And just like you were mentioning something about Dr. Briand, it does paint perhaps a dark image that that the future can have its challenges. And in fact, this is something that you could read out of the report. Pandemics will emerge more often. They will spread quicker. They will damage the world harder, both in terms of life loss and in economic costs. So there is a challenge ahead. And the reason why there is a challenge is very also easily highlighted throughout the entire report. And if I could summarize it with one picture, this is actually one picture of that report. It tells you very quickly that there is a world out there, an ecosystem where pathogens, microbes interact with animals. Normally, they show up, they change, some disappear, other ones appear, and that is the normal cycle of things. And sometimes, as you see on the right side, these will spill between wild animals and humans or livestock. But the speed at which this these events happen is changing, and it's changing mostly because of us. Anthropogenic drivers that are making these balances swift quicker. But the report ends up with a good message as well, so that it's not just a dark future ahead of us. It will tell us that we can escape this dark scenario. We have today all the tools perhaps we need to ensure the future will not again end up with the examples of the past. But for that, we need to understand the links between pandemics and biodiversity. And very quickly here from the poll, I see that more than 70% of you have been reading about COVID, but only 5% have yet read the report. So there is here a potential to spread the message. And I'm very happy that they didn't give me just 3 minutes, because this allows me then to talk a little more with you today. Because media, the connection to the media is extremely important. Just a report that was written last year highlighting the importance of trust in the vehicle for transmitting knowledge. And there is no doubt that today, more than ever, that job belongs to the media. I sometimes find it's interesting, and there's going to be a lecture about statistics later on, but people are trusting more and more science, but the trust on media remains quite low. And that's, at least for me, quite intriguing, because we are totally dependent of the media to broadcast our message. And as a colleague of mine once said to me, and I could adapt that quote for today, is, now, it might be good science if it gets published in Nature, but it's only the truth if it's on BBC or at the Straits Times. So we do need you, and we do need you to do that job with us and for us. And Dr. Briand already spoke about the paradigm shift. And even with communication, things are changing quicker than perhaps all of us can manage. And you know, when I started working in science some 15 years ago, it was perhaps about really acting and working with my press communication office at my institution. He would do the job. More and more, we're getting exposed directly to you science journalists. But in the middle of all of this, we have a paraphernalia of tools that highlight how quickly the message gets spread and how quickly it can get spread wrong. That said, if it gets spread the right way, it has a potential to touch people like never before. And just to give you some metrics, if there are any American colleagues following today, the choice of color here was random, the red. So these are not states that President Trump carried for his election, but they are the countries where the IPBES report has been already taken by the media. So if you're joining us today from one of these gray countries, it's not too late. And if you're joining us from one of the red countries, but you are not the one who wrote an article about this topic of pandemics and biodiversity, it's also definitely not too late for you. So what are these links, and how do we go about it? First, we need to agree on a set of facts if we're going to tell the story right. And this one, I would say, is quite indisputable today. Biodiversity is essential, and biodiversity is getting destroyed. This is just a table I took from an IPBES report released earlier this year. And we don't need to go through those, but those are just 18 examples of services that nature provides to us that we need. They are all on a downgoing trend. We are destroying these services. So we are affecting the biodiversity of the planet. I think it's also quite consensual today that the diversity of species on the planet and the biodiversity in terms of either animals or plants is also on a serious path going down. We are losing species quicker than ever before. This Anthropocene period that some people now call we live in is quickly destroying species. And this also has an impact when you talk about health and how diseases pass between different species, humans and animals. We also know that one of the biggest reasons for infectious diseases to spread and to circulate is the way we change our landscape. We use our planet. And here, of course, agriculture has been one of the biggest examples, but I could quickly say urbanization, the speed we connect and make roads, infrastructure, all those things make a difference. And this is not a matter, it can be a matter of discussion, but it's a matter where scientists have collected a lot of data. This is just an example here from my colleague Zambrana Torello, clearly showing that one of the biggest reasons for driving infectious diseases is land use. There are others. There are international travel, as has been highlighted here. There are changes in demography, climate, but land use will make that. And it's easy to understand. We might be putting together species that should not meet together. They are pressed together. We reduce their habitats. And when you press together things that shouldn't be together, perhaps it's a recipe for disaster. We are also sometimes removing, changing species. And this is an example from Kenya, where in the last 30 years, as you can see in that graph, we've lost up to 80% of water bucks and zebras and replaced them with an increase of 70% of sheep. Livestock is taking over. We are again very dramatically changing the balance in these ecosystems. And these are the changes that can bring problem. I'm not saying they will bring problem, I'm saying they can bring problems. And if I could highlight one that has been very talked about is also the way we relate and we use wildlife. And my colleagues at IPBES have made, I think, a very, very interesting infographic here. Wildlife trade, whether it is legal or illegal, is linked to disease emergence. We know this, it's a fact. And they are in this map here, just a very quick highlight of the number of potential traffic instances of wildlife that can lead to a potential zoonotic risk of disease transmission, whether totally new or just showing up in different areas where it wasn't before. So we know this is happening. And talking about wildlife trade, there's been a lot of talk about the pangolins and wildlife. But also, let's be clear, wildlife should not be blamed for everything that happens bad in pandemics. Wildlife are, of course, related to some of these pathogens. But I think you will agree with me that they don't volunteer for this type of gastronomy. So we need to be careful when we allocate guilt. And there's been a lot of talk about pangolins, especially now for COVID. But I usually tell to my students, people, let's get the facts real. We know pangolins have coronavirus. They've had it before COVID, and they will probably have it before. What is perhaps forgotten is the speed we are trafficking and trading these pangolins. And if your diet includes this dish, you shouldn't really be surprised that a pangolin virus might actually get to you. So these are facts, these are not fiction. And the last one, perhaps, that has been a mixture of a fact and a fiction is, of course, climate change. Climate change is happening. Unless you sit in one or two countries that deny that fact, it is happening. And it impacts infectious diseases. And here just examples of a few diseases in Africa: yellow fever, malaria, West Nile, chikungunya, Rift Valley, that probably due to vector, the use mosquitoes and insects, they are changing. They are moving to countries where perhaps they were not so prevalent or where they were not even there. These things are changing. So these are all facts that biodiversity relates to disease. So like Dr. Briand mentioned, disease X or the pathogen X should not be a surprise. We are getting quicker and quicker, more pandemics, epidemics. I will not lose too much time now differentiating between the two terms, but they are happening at a quicker speed than ever before. And also, let's be honest, they are not just in one geographic area of the planet. We're getting to see these events pretty much around the globe. Wherever you go, these events are happening. And if these facts are not enough, one other fact that the report also highlights is that this is also about money. And the fact is that pandemics, on top of the human suffering, costs trillions of dollars of loss. It's a lot of money that goes into this. And this graph illustrates very easily the amount of money that has been spent just in the last 30 years on foot and mouth, SARS, swine influenza, MRSA, and now Corona, which has a price tag that we're not totally even aware of. But what we are very aware of, and my colleague Andrew Dobson and his team just published in Science recently this year, is that the difference between doing something to prevent it and paying the bill from not predicting and preventing, the difference is big. And we're talking in this paper, as he highlights, something between 21 billions to up to 16 trillions. This is a magnitude. It's not a few millions difference. This is an order of magnitude. So it should be quite clear that prediction and prevention are the way to go. And let me just detour a little from diseases and go to this tsunami picture from Indonesia. And a quote, "When animals go crazy, run away from the sea and go to the highlands." Indonesian children have been taught for centuries to look at the animals to avoid disasters. We know this and this is just a newspaper from the US, birds foreseeing an earthquake. We know it's possible to look into nature to predict catastrophes. And I'm originally from Portugal, so I would even add here an example. We had the catastrophic earthquake in 1755. It destroyed the capital, Lisbon, but we've learned about it to do, and we prevent it by building an anti-seismic downtown. So it looks like humans have learned how to predict and to prevent. So I would argue, why is it that we might be on the 6th, the 7th, the 8th pandemic of the century, it depends on the last 100 years, not of the century. Are we that good at predicting and preventing? Are we doing a good job? Let me show you here these 3 quotes. I'll give you just a few seconds to read through them. And as you read through them, you will probably agree with me. This is something that probably President Macron has just said, or probably Angela Merkel or Boris Johnson. This sounds exactly what we're being told to do in Europe and across the continents. That's probably true. The issue is that these bullet points weren't written by them. They were written in 1348 by the Venetian City Council to fight the Black Plague. So the prevention measures haven't changed that much. And an old picture from Peter the Older that you might know doesn't look very different from some of the pictures we got. That one is from Long Island this May. This is just another way of saying, are we doing enough to predict and prevent? And if we're going to do enough, we need the people to come along. And keeping the people interested is not easy. This is just a very easy metric from Google showing how much people Google for the word pandemic. And you do see the spikes. You know, when we had influenza, when we had MERS, there is no doubt that COVID is a game changer. But we see people interest or Google interest for this fading away. Is it fatigue? Are we all coronavirus experts? Or are we starting to forget about it as we approach a vaccine? Because that is the danger. Soon enough, the vaccine will come, we all hope for. We will win this battle. We will then move to building up our economies. And the question is, will we forget about pandemics? And it's here that the media have the power to influence and have the power to make a change. But then we need to do it right, people, I would say. And just to illustrate an example, some of you will know that my Danish colleagues are struggling with corona in the mink populations, and have set in motion a process to kill millions of mink. And this is just 10 days ago of a British newspaper. Same day, same issue. On the left, corona in minks. On the right, corona in a football player that because of Danish ban into the UK will not be able to play football. Different sizes, different relevance, different aspects of the same story. And this is not just about COVID. If I want to be critical, I could go back to Ebola. We've known Ebola for many years. It's 30 years that we've been struggling with it. It's been killing thousands of people and actually animals, primates, species under threat of extinction. It's been hitting and hitting. And we've known the facts. We know that hunting and butchering and processing of wild meat is behind a lot of these outbreaks. And despite the best intentions of WHO over the years to try to get the focus to this, we needed 2014 and thousands of people trying to die in bigger settlements in Liberia and Sierra Leone. We needed the media to focus on this for suddenly it becoming a world attention. And if I want to be critical, it needed actually for Ebola to become an European disease, because these are pictures from Europe. And the one on the lower corner, it's what I mean, it was a TV media show. It's a picture from Oslo. Our first patient with Ebola arriving. This was a helicopter live on TV, full coverage. But it comes after thousands of Africans dying without little or no coverage. So the media has a role. So this takes us back to Corona, which is now the popular one. And one of the questions people are asking, how much do we knew about it? Could have prevented it? I won't go into that today, but there is no doubt that we're doing more science about it. We've been publishing around 500 papers around the world in corona. We've just passed 30,000. And these are being scrutinized by the media on a daily basis. But if you go back to those years, among those 500 people, there were coronavirus papers about bats. Just out of there of Singapore, my colleague Lin Fa Wang, which is one of the biggest corona and bat researchers, virologists, we've known viruses close to corona have been there. They have been around. Have we heard? Is it a problem that we haven't gave the message? Is people not listening? Are politicians not motivated? So the message here would be, are you listening? And is prevention and prediction perhaps the path to go the next time? And this is something what the report tries to summarize, but the report, as I mentioned, then tries to provide you some answers, some solutions how to move. And better for me than me to tell you, I'll leave you a short movie on how the report summarizes some of what can be done to prevent future pandemics. Let's follow. This was a very quick highlight of what could be done. And among these measures, some have now got some of the attention of the media. And among them, perhaps one of the most discussed has been a governmental, intergovernmental council on pandemic. And this is to realize that it's not in any way a disvirtue or dismerit of what WHO, FAO, and many are doing. We need these organizations to keep on the fight. But it is also realizing that once COVID is finished, WHO has many other challenges to face. We have malaria, tuberculosis, HIV. They have their limitations as well. And the same could be told about many other organizations. It would be a difference to have a structure, a group of people that can look into the science and that can give advice on how to prevent pandemics. We see, for example, with climate, which I guess we all agree is relevant for WHO, for the World Bank, for FAO, for OIE, you name it. Climate is relevant for all of them, but the IPCC has become a well-established, renowned reference, providing knowledge-based advice for those who need to make decisions to take those decisions. So I think it's consensual to say that might perhaps be a measure. And there are many more. But the most important I leave as a message that many of the measures the report will focus on will depend on me, will depend on each one of you to enable. It's about changing the way we live, changing the way we transform and use the resources of this planet. It's about education next generations. It's about making better use of the indigenous knowledge all around the planet. And it's about realizing that pandemic needs to be part of the equation wherever you go, whatever you do. And it's not a problem for the doctors because it's a human disease, and it's not a problem for the vets when it's a wildlife disease. It's a problem that needs us all to work together. So this is the message I leave you today, and I think the report leaves is that by doing this, me, you, everybody, from the single person to the government level, we might be better prepared when it hits again. And not to be sober, but to be very realistic, I would still say that prediction and prevention have a value that cannot be quantified in dollars. And this is a picture none of us in Europe would have thought possible just 1 year ago. This is a parking lot in Barcelona transformed in a morgue. And this is a picture of a mass slaughtering of millions of mink in Denmark because of a pandemic risk. So the solutions are there, my friends, and all of those listening. Science will continue to provide evidence, but to ensure the science reaches where it should, we need all your help, all of you. And my final message, which is perhaps also been named by several of the experts in the reports, is that the way we're doing it right now doesn't work. And the time to change is not once this pandemic is finished, is not when the next pandemic approaches. The time to change is right now. So thank you very much for listening. And if, I suppose for any questions on the report itself, you can take contact directly with IPBES. They might direct you to the several of my colleagues, with 22 of us, that can discuss with you any questions you may have. But I also leave you my email in case you have any doubts. Thank you very much for your attention.
Thank you, Dr. Neves. You know, you say the time to change is now, but what needs to change? The blame doesn't lie with the wildlife. It doesn't, you know, and you're right. But Dr. Briand says 70% of emerging diseases in human beings come from wildlife. Is there any particular wildlife that is more likely to spread diseases to man? You mentioned pangolins. Is that the biggest culprit?
Thank you for your question. Well, what needs to change is, first of all, I would say, is to get this discussion on the table. And just to give you the results of the poll, most of you, 75% of you, did write about COVID, but less than 8% wrote about biodiversity. So I guess the wildlife aspect has been a little forgotten. No, we need to be careful blaming the pangolin. We do know that there are hotspots for disease emergence. And these are, of course, the places where all these wildlife species more often interact with humans. So that's why we see these things coming out of China and out of Southeast Asia. So the other day, a reporter asked, why not the Amazon? There is a lot of biodiversity there. Absolutely. But there is still no people. But let's be honest, as we destroy the Amazon and move into the Amazon as in areas where we were not, we will meet these species, these bats and these other. So I won't find to blame a species more than others, but we know that bats, rodents, have been some of the big taxa associated with the emergence of diseases. So yeah, you can find a few that are more likely to harbor, I don't want to say to be dangerous, but to harbor pathogens that can be dangerous to humans.
Right, thank you. Now, a lot of people blame the current pandemic on China's wildlife markets. The question is, if China was to do away with all their wildlife market, would that significantly reduce the risk of a new emerging pandemic?
Again, I think it's important, answering your question, yes, wildlife trade and wildlife markets are an increased risk for disease emergence. But it's also important to frame this correctly. There is no such thing as Chinese wild markets. We see them all over Southeast Asia. We see them in Africa, where the cell of bushmeal is behind Ebola. And it's true that some local sustainable communities live from hunting wildlife and consume it, and that's okay. But the exponential, massive production of this business is an issue. So yes, if you would reduce this in China, in Vietnam, in many other countries, in Asia, in Africa, even in South America, you will likely reduce the chance of emergence.
Right. But as you say, you know, in Africa and places like that, a lot of people depend on it for food as well. So it's not so easy to do away with it altogether. Are there any precautions people can take, even if they were to continue with legal wildlife trading?
I suppose you're absolutely correct. There are sustainable hunts and people that depend on this for their livelihood and for their nutrition. That's a very different picture from the gigantic markets to feed a ever-growing, curious gastronomy desire of a lot of people around the world. There are two, perhaps, factors that need to be put in place. One is education, and the other one is biosecurity. So, and these two need to be combined. You need to explain to the people the risks associated with some of this consumption and some of the very easy measures that can be taken to avoid these risks. Some things can be sorted out by properly cooking and preparing these meats. Others can be solved by proper protection tools when you interact with this. So there's a lot of biosecurity, but it needs education. We need to explain to people the risks and the options they have on the table to avoid them. And that job will be much easier with all of you on board.
Right, so as you said earlier, it's up to all of us. So if people do not want or demand such exotic food, then the risk goes down. Thank you very much.
Absolutely.
Yeah.
Thank you very much.
So we'll go to the last speaker for today. That's Professor Denise Lieveseley, an expert in social statistics. Well, okay, that's understating it. I believe Professor Lieveseley has so many achievements that it's impossible to list them all. So I'll just go with two. She was the former chief executive of the English Information Center for Health and Social Care, and she also held the post of Director of Statistics at UNESCO. In her talk on evidence-based facts and the fight for the truth, Professor Lieveseley will tell us why independent statistics are so critical in tackling misinformation and holding governments to account. Professor Lieveseley, over to you.
Thank you very much. I'm going to share my screen. Hope this is okay. Yes, fine. Thank you for the invitation, and I've just enjoyed two wonderful talks. I'm feeling very humble at this stage. I'm not going to specifically be talking about COVID, but I hope that what I'm going to be saying about statistics will have resonance for addressing statistics relating to COVID. So I'm talking about statistics more generally, and I want to stress that I'm not particularly a health statistician, I'm a social statistician. So when I, let me try and move on. Having difficulty, there we are, right. When I'm talking about statistics, I'm talking about both the numbers themselves and the science of statistics. And of relevance to today, I think about statistics as being the science of uncertainty. We look for patterns and relationships. We're trying to separate the signal from the noise, but basically it's about understanding uncertainty. And I think that's important because one of the issues we might discuss is the fact that governments have talked about following the science as if there is one science and we know the truth. Of course, we're all aiming to understand better, but there's still uncertainty involved. Statistics, of course, are fundamental for evidence-based policy and decision-making. But one of the issues that I think is critical is that they enlighten us through making explicit what is known through scientific evidence, but also, importantly, what isn't known. And in my talk today, I want to draw parallels between statisticians and journalists. I think we're both seeking to inform, we're seeking to speak truth to power. We often want to shine a light on the marginalized, the people on the edges of our societies, to understand the breadth of an issue and to expose what sometimes are uncomfortable truths. So statistics are critical for decision making, but like responsible journalism, they also serve to empower. They enable citizens to call governments and public servants to account, and they're part of our democratic systems in providing a window on society. And we've seen, and we will continue to see, as we hopefully emerge from this pandemic, we will see a lot of analysis about how governments have done, and they will be using statistics. One of the critical issues is who sets the statistical agenda. Is it set centrally? Who can influence it? So I said earlier that statistics, one of the important issues is enlightening us as to what isn't known as well as what is known. What isn't collected tells you some things about the priorities of government or of society. So here in the UK, we have had an issue over the poor statistics that we had relating to residential homes. And it took us quite a long time to get the statistical system together to collect data on people dying from COVID or even suffering from COVID in residential homes. And the social care system has been a low priority for many years by successive governments. And that was what was highlighted by us not knowing information. Policy-based evidence has become a mantra and you hear it everywhere. But it's important to realize that evidence is sometimes resisted. Even John Maynard Keynes talked about there being nothing a government hates more than to be well informed, for it makes the process of arriving at decisions much more complicated and difficult. I think that was a tongue-in-cheek comment from him, but there is some truth in this. And particularly as I was saying, there isn't one scientific answer. Science is a complicated process. There will be very many different perspectives. I loved the image of the elephant that we saw earlier with people with different expertise, having a different picture. And so governments want to be given one set of information, to be led in relation to one set of information, and it's very complex. That's not the situation. Carlos, immediately before me, talked about the importance of both trusted information and trustworthy information. And I want to stress that. We want to avoid fights about the data. We want to be addressing the issues. We want statistics to be the currency of public debate. So they need to be both trustworthy, but also trusted. How do we decide whether to trust statistics? Well, as journalists, I think many of the tools that you use in your everyday work are really critical here. Understanding the provenance and the source of information, the methodology used. One of the critical issues is who participated in this study and how many people participated. The expertise of the people carrying out the study, the statisticians or the scientists, the independence and the transparency of the system, whether there are incentives to report in particular ways, and I will be talking much more about this in the next few minutes. And then, of course, we can decide whether to trust statistics by triangulating, looking at an issue in a number of ways and trying to check the validity in that way. So the use of qualitative information alongside quantitative information, for example. Critical issues are whether the statisticians are shielded from undue pressure. What happens when they produce uncomfortable truths? Do politicians seek to distort the results? Do they produce what is now known as alternative facts? A really weird terminology, isn't it? Who appoints the statisticians? So in some countries, statisticians report to Parliament rather than the government of the day. And what is the relationship of the statisticians to the media? Are they free to report their findings? What approval processes need to be gone through? I've spent a lot of my career trying to fight for the freedom of statisticians to report data irrespective of whether they are uncomfortable. There are many, many different aspects of the quality of statistics, and it's important for us to realize that statistics that are valid for one purpose may not be valid for another purpose. And again, I think as journalists, you will understand this. I was listening just recently again to that wonderful talk that Obama gave at the White House Correspondents' Dinner, his last White House Correspondents' Dinner. So it's about 4 or 5 years ago now. And in that, he talked about the pressure on journalists to produce speedy output rather than in-depth. And earlier we heard about some of the problems of the reduction in the number of specialist journalists, scientific journalists in particular. So this whole issue of speed versus depth is a critical one. But we also know that data produced too late to be of value, it may be perfect data, but if it's too late, there's no use for it. And one of the things that we have really struggled with as statistical systems over the COVID is the need to collect data fast and report that data fast, even if it isn't perfect, to try to ensure that we've got data that can be used for immediate results. So quality isn't an absolute. We have to think about fitness for purpose. And timeliness always has to be balanced against other aspects of data quality. And the data requirements of an estimate for today are very different from the data requirements if I'm looking at change over time. This often isn't understood. So if we're wanting to look at how our COVID data change over time, then we need comparable data over time. Whereas if we're looking at the best estimate for today, comparability is less important, but the quality of the information today is critical. Are we using data to make comparisons over time or over different parts of the population, over different countries? We've had a lot of discussion about whether we can compare the COVID data across different countries. Is a rough estimate adequate, or must the results be precise? I want to stress the importance of statistics in relation to performance monitoring. I often talk about the UK as being the land of the performance indicator. We have got performance being monitored right across all of our public services. And one of the difficulties is that those data are often expressed as targets, and they're often used for naming and shaming or for league tables of performance. The Royal Statistical Society, many years ago now, produced a fantastic report on performance monitoring that they called The Good, the Bad, and the Ugly. And I think that really sums up my views of performance targets and performance indicators. They have huge benefits in terms of calling to account, but they also risk distorting information. And I want to say a few words about that. So two quite interesting laws are Goodhart's law. Goodhart was an economist, and he talks about when a measure becomes a target, it ceases to be a good measure. Here in the UK, we saw this when the government decided to make a target the number of tests that they carried out. And then we saw corruption of the data relating to tests in order that they could prove that they'd met the target. It became a political issue rather than a good measure that helped us design better systems. And David Boyle, in his Tyranny of Numbers, talks about the paradox that if we don't count something, it gets ignored, and if we do count it, it gets perverted. So there's a huge tension in relation to statistics when they are taken up by governments in order to show their performance. And one of the difficulties is that because it's hard to measure what's really important, we often measure something slightly different, a proxy, and then we risk resources being devoted to achieving the wrong target and there being unintended consequences, hitting the target but missing the point. Robert Kennedy had this wonderful quote. I won't read it all out, but I think it is worth studying at some time. And it really talks about the fact that what we count isn't necessarily what is important to us. And as a statistician, I think I should have that on my wall and should read it each day. It's really critical for us to understand that counting is important, but we also are really poor at measuring the quality of issues that are important to us. And that was really what underlay the move from the Millennium Development Goals to the Sustainable Development Goals. This concern that the Millennium Development Goals really drove an unrelenting pursuit of growth at the expense of the environment. And we've just had a really important talk on why the environment broadly is critical to us. That there's concern about the inequalities within our societies, that growth is often at the expense of the poorest within our societies, that people get left behind. Recognition that it behoves us to give visibility to the disenfranchised in our societies. And hasn't COVID shown us this, that the people who have struggled with COVID are often those that are marginalized. And the challenge that we have about whether we should concentrate on a small number of statistics or should we be all embracing. A lot of statistics relating to COVID have been global data. I mean, boundaries don't mean anything in this current world. We all are in this pandemic together, and we need good global data. We need good comparable data for reasons of accountability, not just to our national governments, but also of the international bodies, the agencies that are working across boundaries, for advocacy and resource mobilization, for us to know about the strength of the problem that we're facing, but also for comparative purposes, and not to name and shame, but because understanding of oneself is gained through knowledge of another. We learn from one another. So I think one of the things that will be fascinating is countries that have had different policies as we hopefully emerge from the pandemic, learning, was Sweden's policy to the benefit, and in what ways, both economically and in terms of the number of deaths and illnesses. How do we decide what to collect globally? Well, governments sign up to goals and commitments at various world and regional summits, and they're party to conventions and agreements, but they also accept, if they're poorer countries, they accept commitments as part of aid packages. This is a very slow process, and one of the difficulties is that the power has been held by the richer countries. We're seeing shifts away from this, what I call statistical colonialism, but resource issues remain critical. So I've concentrated here on the difficulties, the problems that we have in terms of governments not being willing to collect high quality data, but there's also an issue of resources. And there's always a tension between the needs of the cutting edge countries and the trailing countries. My last slide is really to stress that journalists and statisticians need to work together. Statisticians are very conscious of the fact that figures have a spurious credibility and that they're sometimes wielded like weapons. And your journalistic skills remain absolutely critical and even more important at the moment. So being skeptical and asking questions, not being beguiled by the fact that these are numbers, Numbers can be made up in just the same way as words can. They can mislead and they can be misreported deliberately or through ignorance, or maybe I should say through lack of resources. Too often statistics are trusted simply because they imply scientific precision without an appropriate investigation of their validity. So I would say strength to journalists working together with statisticians at this important time in order to improve the quality of the information we have. Thank you.
Thank you, Professor Lieveseley. That was extremely interesting. Now, do we depend on statisticians for data only or for the interpretation? Because very often you can have the same set of data and then you interpret it very differently and then the results are very different.
We depend on statisticians for both, and that's why I started off by talking about statistics and not just the numbers, but also the science, and that's partly interpretation. But of course, other people interpret the data too, and statisticians are not necessarily the people with the substantive expertise. So you actually want data to be available, and a lot of my career has been spent about trying to ensure access to raw data for scientists to analyze, so that you want a variety of different analyses. And of course, that uncertainty and the fact that there are different interpretations is part of the problem about how do you convey to people that they should trust the data when there's a variety of different interpretations. It's a problem. It's a problem. But I would argue that we always want data to be used by multiple people. Data, to me, are the only thing that grow in value the more they're used.
Thank you very much. We have some questions from the audience, but before I go to that, could I ask all three panelists, looking back over the past 10 months, could you point out where you think the media may have done well and where, well, maybe we have not quite fallen flat on our faces, but where we could have done much better? Is Dr. Briand around? Then why don't we start with Prof Lieveseley?
Okay. As a statistician, the last 10 months have been amazing in that statistics are suddenly high profile. And, you know, before, I'm not going in a taxi at the moment, but before the pandemic, if I went in a taxi and I told a taxi driver I was a statistician, it was the immediate end to the conversation. Whereas now it's the start to the conversation with people because everybody is understanding the importance of data, and that is due to journalists. I think they've done remarkably well in terms of promoting the importance of high quality data, trying to get out regularly to us comparable data, trying to point out ways in which there have been failings. Where there are difficulties is where the statisticians are not independent enough from the governments, and the governments are obsessed with showing their great performance rather than actually showing us the truth. And so we have seen that in a number of countries, and I don't blame the journalists for that. I think there is a difficulty in terms of the way the media are set up in some countries and their lack of independence.
Thank you. Dr. Neves, would you like to add to that?
Yeah, I suppose very briefly, I mean, I think we need to praise the media for the remarkable job they've been doing in forwarding the importance message. I mean, the efforts that we're all doing for prevention, you know, everything from washing your hands to raising awareness that this is not a problem in a faraway country. This is your neighbor that might be on an ICU intubated in 1 week. So on that matter, the media has served a unique role in taking the recommendations of scientists, WHO and governments to the people in a straightforward way. The challenge, at least I mean, from my side as a wildlifer, but also as someone that works with politicians, the challenge might be sometimes the desire of a very early guilt attribution or trying to look for the origins. I would say this is not the time to start looking where who is guilty for not having what and what could we have done. Is it the Chinese virus? Is it the Vietnamese virus? We are in the middle of a situation that needs to be solved. So the media has perhaps sometimes, and I understand, been a little too quick trying to jump into something that will probably be very flashy on the front page of the news, but diverts the attention from where we should focus it, solving the problem.
Right. Dr. Neves, sticking to you, there's a question from the audience. Johannesson is asking, which is the bigger risk from the animals, your animal slide? Is it wildlife or livestock, factory farming? Because most people say wildlife is not me, it's far from me, but the problem is still there. So what's your answer to that?
I try to quickly just comment on that on the chat, but there is no doubt that where you see a lot of the pathogens that might be more dangerous to humans is usually on the wildlife. But the best way for these pathogens to expand and to contact humans is usually through livestock, because those are the species we interact a lot more. So if you're putting a very intensive livestock production on the same spot where you have these wildlife species and they touch with each other, you shouldn't be surprised that problems will come. So it's not a bigger risk from the wildlife or the livestock, it's perhaps a bigger risk in the way we interact with these species. And I try to illustrate with NIFA, which in Southeast Asia should be a well-known situations. It comes from the bats, but it was the fact that pig farming was happening next to the bats. The pigs got infected, and it's the pigs that quickly get the virus to humans. Humans don't daily go on a routine shaking hands with the bats, but humans do on a routinely go on handling the pigs. So that's to answer your question. Let's not say one more risky than the other. Perhaps it's the way we work with them.
Right, thank you very much. Now we've got a couple of people asking basically the same question. Prisha and Junie are asking why governments are waiting for a cure, for a vaccine, for the silver bullet. Why aren't they doing more to stop the pandemic from spreading? Because everybody knows prevention is much cheaper than cure. Maybe Lieveseley or both of you will get a chance to answer this one. Prof Lieveseley, would you like to start with that? Ladies first?
Fine, ladies first, but I'm not the expert in particular in relation to COVID. I think governments have taken very different policies, and indeed many governments have, at the huge expense of the economy, taken very serious attempts to stop the spreading through things like lockdowns and so on. As Carlos, I hope I will be able to say, as Carlos has just said, it isn't until the end of this process that we will actually be able to analyze. But fortunately, we will have a number of natural experiments, and I hope there will be analysis then to look at the effects of the different policies.
Dr. Neves?
Prevention and prediction is better than cure. You said, yes, everyone says that today. But 11 months ago, I mean, we're only humans. It's not easy to commit a large sum of money to try to avoid something that might actually never happen. That has been a little of the challenge. And just to highlight this, some of my colleagues have been, and the report from IPBES talks about this. There is a quote about perhaps 1.7 million viruses, unknown. Some of these 800 of these might be dangerous to humans. Some of my colleagues have been lobbying that, these days it would be possible to sequence. We know where these viruses likely are, the areas. We could go there and sequence everything, because the vaccine is not the only prevention. It's the most famous one, but not the only one. And to develop a vaccine, you need to know against what. We can go out, we can sequence all of this in advance, so the information is on the table. This will cost you perhaps $120 million a year for the next 10 years. That's 1.2 billion. That was, to many politicians, a fortune to spend on a risk that might not be there. I would argue that we have passed the 1.2 billion loss in the economy a few months ago.
Right. So the trouble is, if you don't see the problem in front of you, the politicians aren't willing to spend. Now, I've got a question from Timothy Goh, who's a colleague of mine at the Straits Times, and this is to Professor Neves. You're talking about the role of media in telling people, preparing the population, etc. He's asking, would you say it's the responsibility of journalists to sift through publications and anticipate the next disease? And if so, how do journalists prevent themselves from falling into the trap of fear mongering? Given that we all have generalist backgrounds, we are not specialists ourselves.
No, I won't be that dramatic as tell you that you have to go through everything that we published and be on top of the issue. But I suppose what this shows is the need to have, I would call a long-standing collaboration in keeping some topics in the media attention, so that you both get trained into talking about things and we get trained how to explain them. Scientists also need a lot of training to explain papers to journalists. It's a mutual effort. But I could tell you that 7 months ago, it was almost impossible for me to convince any journalist to write about wildlife on a front page of a journal. Now it's the most popular thing to do. I just need to scream pangolin and everyone wants to write something about pangolin. So we need to educate both sides to keep a long-standing collaboration on these big topics. Biodiversity is a good example. And then we can perhaps tips you what is the most important things. We can learn together and keep these topics going so that when the next pandemic happens, you can do the screening much better without the risk of the fear mongering of generalist backgrounds affecting you. It takes
May I
time.
add something?
Yes.
May I add something? I think one of the things that we've learned we need more of is intermediaries. So we have something called the Science Media Centre here in the UK, and it has been fantastic, absolutely wonderful. So I think that, I was arguing for journalists and statisticians to work together more closely, and I believe that's important very strongly, but I think more centres that are going to help journalists translate scientific material and filter, sift out scientific material, really, really valuable. So, one of the things I will be looking to try to do in the future is to get funding for centres such as the Science Media Centre.
Right. But, one of the problems is that a lot of people who are in the know are also the ones who are so busy with research into the current pandemic. So while they're happy to help, and actually in Singapore, we've been very lucky because our experts have given us the time and they've spent the time to explain things to us. But it's not easy for them to do two things at the same time, fight the pandemic and take the time to explain in ordinary words to journalists what they can do. So Prof Lieveseley, if you could have this group that is not actively involved in fighting the pandemic, help explain things to journalists, and if all other countries can do that, I think that's a great start. I think we've run out of time. We are a little bit over time already, so that was most interesting. We as journalists will see what we can do to help educate the population. I remember when the pandemic first started and we wrote about it, it created instant panic, and then we had people rushing out to supermarkets to buy toilet paper, things like that. Exactly. So we have to see what we can do about disseminating information without creating the same fear. Thank you very much, Professor Lieveseley, Professor Neves, and Dr. Briand. Goodbye.
Thank you.
Thank you very much.
Thank you. Bye-bye.
For today.
Brilliant. Thank you very much, Salma. That was expertly handled. And thank you both Dr. Lieveseley and Professor Gonzalez for your time. And then finally, just once again to thank Temasek Foundation for making this session possible, and also to the Science Council and Quest for their expert input on making sure the program was fit for purpose. And I think after the start we've had, it sets a great framework for today and the two sessions tomorrow.